Hey everyone, Dr. Mike here. Today, we're diving into chronic parasitic infections, an often overlooked but important topic in medicine. Unlike short-term illnesses, some parasites can live inside us for years, causing subtle, persistent health problems that are hard to diagnose. These infections impact millions worldwide, draining energy and affecting quality of life. Parasites are masters of disguise, often mimicking conditions like IBS or chronic fatigue, leading to years of misdiagnosis. With global travel and complex food chains, the risk is rising everywhere, not just in remote locations. Knowledge is your best defense. In this video, we'll break down what these parasites are, how you get them, what symptoms to watch for, and how to protect yourself. Let's get started. Let's meet some notorious chronic parasites. Plasmodium, the malaria parasite, can hide in the liver for years, causing relapses long after the initial infection. Schistosoma, or blood flukes, enter through fresh water and lay eggs that trigger chronic inflammation, leading to organ damage over time. Giardia lamblia, often picked up from contaminated water, can cause long-term digestive issues and is frequently mistaken for IBS. Toxoplasma gondii, linked to cats, forms lifelong cysts in tissues. It's usually harmless, but can reactivate in people with weakened immune systems. These examples show how parasites can persist undetected, causing chronic health issues. They're not just tropical threats. Many can be found closer to home. Recognizing their tricks is the first step to fighting back. Let's see how they get in. How do parasites invade our bodies? It all begins with the process of transmission, which is the way these organisms find their way from the environment or from other hosts into us. Understanding these routes is crucial for protecting ourselves and our communities. Contaminated food and water are among the most common culprits. Imagine drinking from a stream while hiking, eating undercooked meats at a barbecue, or preparing a salad with vegetables washed in unsafe water. Each of these scenarios can introduce harmful parasites into your body, sometimes without you even realizing it. In many parts of the world, vectors like mosquitoes and flies play a major role in spreading diseases. Mosquitoes can transmit malaria, while sandflies are responsible for leishmaniasis. These insects thrive in warm, humid environments, making certain regions especially vulnerable. Even a single bite can be enough to transmit a parasite. Direct contact with contaminated environments is another significant risk. For example, swimming in lakes or rivers where parasites live can lead to infections like schistosomiasis. Walking barefoot on soil that contains parasite eggs or larvae, especially in rural areas, can result in hookworm infections. These risks are often highest in places with limited access to clean water and sanitation. Some parasites, such as pinworm, spread easily from person to person, particularly among children. Simple actions like sharing toys, touching contaminated surfaces, or not washing hands after using the bathroom can quickly pass these parasites along, making outbreaks common in schools and households. Prevention starts with understanding these pathways. By learning how parasites move from one host to another, we can take steps to block their journey and protect ourselves and those around us. From the food you choose at the market, to the water you drink while traveling, to whether you wear shoes outdoors, every decision can help reduce your risk of infection. Being mindful of these choices is a powerful tool in disease prevention. Simple habits like wearing shoes, drinking filtered or boiled water, and washing your hands with soap can make a big difference. These small actions practiced consistently are some of the most effective ways to stay healthy. Knowing the risks is the first step to staying parasite-free. Education and awareness empower us to make safer choices and to share this knowledge with others in our community. Next, let's talk about what to watch for. Recognizing the signs of infection early can help prevent complications and stop the spread to others. Early detection and prompt treatment are key. By staying alert to symptoms and seeking medical advice when needed, you can protect your health and the health of those around you. Chronic parasitic infections are especially challenging to identify because their symptoms are often vague, subtle, and develop gradually over time. Unlike acute illnesses that come on suddenly, these infections can linger for months or even years, quietly affecting your health and well-being. Digestive issues are among the most common signs. Persistent bloating, diarrhea, constipation, or abdominal cramps can all be indicators. These symptoms are often mistaken for irritable bowel syndrome, food intolerances, or even stress, making it easy to overlook the real cause. Profound fatigue is another hallmark of chronic parasitic infection. This isn't just ordinary tiredness, it's a deep ongoing exhaustion that doesn't improve with rest. Parasites can steal vital nutrients from your body and keep your immune system on high alert, leaving you feeling drained day after day. Skin problems, such as unexplained rashes, sores, or persistent itching, may also be a clue. Muscle aches and joint pain, which can be mistaken for overexertion or aging, sometimes signal a chronic infection as well. Some parasites even affect the nervous system, leading to brain fog, memory lapses, or mood changes. This can happen because of inflammation in the brain or the loss of essential nutrients, making it harder to concentrate or remember things. These symptoms often overlap with other, more common conditions, which makes diagnosis especially challenging. Many people go from doctor to doctor, searching for answers, without realizing a parasite could be the underlying cause. If you have unexplained, persistent symptoms, especially after traveling to new places, spending time outdoors, or drinking untreated water, it's important to consider the possibility of a parasitic infection. Listen to your body and pay attention to ongoing, unexplained changes in your health. Don't ignore symptoms that persist or seem to have no clear cause. Early recognition of these subtle signs can make a big difference, leading to a faster diagnosis and more effective treatment. Next, let's explore how doctors work to uncover these hidden invaders and get you on the path to recovery. Diagnosis is the next step in your journey to better health. Diagnosing chronic parasitic infections is detective work. It starts with a detailed medical history. Symptoms, travel, lifestyle, and exposures all provide crucial clues. Stool tests are common for gut parasites, but multiple samples may be needed since parasites don't always shed eggs. Blood tests help diagnose parasites like malaria or toxoplasmosis, either by spotting the parasite or detecting antibodies. Imaging, like MRI or ultrasound, can reveal organ damage or cysts in complex cases. Sometimes a biopsy is needed for a definitive answer. Combining history, lab work, and imaging helps doctors pinpoint the culprit. Accurate diagnosis is essential for effective treatment. Now, let's talk about how these infections are treated. Once diagnosed, most chronic parasitic infections can be treated with targeted anti-parasitic medications. The drug choice depends on the specific parasite. Giardiasis needs metronidazole, schistosomiasis requires praziquantel, and so on. Some infections need combination therapy, especially if parasites hide in organs like the liver. Severe cases may require additional support for organ recovery. Nutrition is vital, replenishing lost nutrients and supporting gut health with probiotics and a balanced diet aids recovery. Follow-up testing ensures the infection is truly gone and monitors lingering symptoms. Recovery can take time, but most people regain their health with proper treatment. A comprehensive plan kills the parasite, heals the body, and prevents relapse. Next, let's focus on prevention, your best defense. Simple steps can keep you safe. Prevention is the best medicine for parasitic infections. Wash hands thoroughly after using the bathroom, before eating, and after contact with animals or soil. Drink only purified or boiled water, especially when traveling or outdoors. Avoid raw or undercooked meats and be cautious with salads and unpeeled fruits in high-risk areas. Use insect repellent and bed nets to prevent vector-borne diseases like malaria. Always wear shoes outdoors to avoid soil-borne parasites. If someone in your home is infected, wash bedding and disinfect surfaces to prevent spread. A little caution goes a long way. Simple habits can protect you and your family. Stay informed about risks when traveling or exploring the outdoors. Prevention is powerful. Use it. Let me share a real story that perfectly illustrates just how easily chronic infections can be overlooked, even by experienced healthcare professionals. Sometimes the clues are subtle, and the answers are hidden in the details of a patient's life that might seem unrelated at first glance. A woman in her 30s came to our clinic, frustrated and exhausted. She'd been struggling with persistent fatigue, uncomfortable bloating, and unexplained weight loss. For over a year, she'd been told she had irritable bowel syndrome, or IBS, and was prescribed various treatments that never seemed to help. Her symptoms lingered, affecting her work, her relationships, and her overall quality of life. When we took a closer look at her medical and travel history, we discovered something important. She had spent several months backpacking through Southeast Asia, exploring remote villages, swimming in freshwater rivers, and occasionally drinking water that may not have been safe. She'd also sampled local street food and lived like a local, immersing herself in the culture. Standard stool and blood tests came back negative, which can be discouraging, but we didn't stop there. More specialized blood work revealed antibodies to strongyloids, a type of roundworm that can be contracted from contaminated soil or water, especially in tropical regions. This parasite can live in the body for years, causing vague symptoms that are often misdiagnosed. With the right medication, her symptoms improved dramatically. Within weeks, her energy returned, the bloating subsided, and she began to regain the weight she'd lost. She was finally able to return to her normal life, feeling healthy and hopeful again. This case highlights why it's so important for doctors to take a thorough patient history and to consider less common causes like parasitic infections when faced with unexplained persistent symptoms. Sometimes, the answer lies in a detail as simple as a past trip abroad. Travel, outdoor adventures, and even seemingly minor exposures can all be important clues. Activities like hiking, swimming in natural water, or eating local foods can introduce risks that aren't always obvious. If you or someone you know is dealing with vague, ongoing symptoms, don't settle for a generic diagnosis. Keep asking questions and encourage your healthcare provider to dig deeper. Sometimes persistence is the key to finding the real answer. The right diagnosis can truly be life-changing, bringing relief not just to the patient, but to their loved ones as well. So remember, never underestimate the power of a detailed history and a curious mind. Let's wrap up with some final thoughts. Chronic parasitic infections are real, treatable, and often overlooked. If you have persistent, unexplained symptoms, trust your instincts and advocate for yourself. Simple prevention, good hygiene, safe food and water, and travel precautions can protect you. If diagnosed, effective treatments are available, and recovery is possible. Stay informed, stay proactive, and don't give up on finding answers. Knowledge is your best tool for health. Thanks for watching and taking charge of your well-being. Stay healthy and curious.